Evening on Health Digest with me, Dr. Mercy Korir. And tonight we are looking at the issue of abortions in Kenya. Now, almost 500,000 induced abortions occur every year in Kenya. Close to 200,000 women receive care for complications of induced and spontaneous abortion in some health facilities. These women who sought abortion-related care were educated and uneducated, urban and rural women, Christians, Muslims, and women of other faiths, students, teachers, married, divorced, and the unmarried, the employed, and the unemployed. Basically, every woman is at risk of abortion or may seek abortion services. Now, tonight, we'll delve into the dark and painful world of unsafe abortions. And to start us off in this discussion, I bring you a story from Rongo of a mother who had to see her child go through an unsafe abortion. Take a listen. Imagine your 17-year-old daughter showing symptoms of pregnancy. You confront her, and as most teenagers, she refuses to tell you the truth.
Nilinunua pregnant test, nikapima. Nilipata kama kuna mimba. Nisikia uchungu kwa sababu msichana wangu alikuwa na mimba.
You get worked up and send her away. That's the story of Nyaugenya, not her real name, and hundreds of thousands of others.
Akaenda, akanunua dawa, akameza. Ikirudi kama anasikia mbaya sana.
For a mother who knows such pain, Nyaugenya and her daughter had to clandestinely work together to get rid of the pregnancy without the knowledge of her husband, who was all this time sleeping in the same room.
Niambia usipige kelele. Kama tumbo anauma, usipige kelele. Utasikia uchungu sana, lakini vumilia tu. Ikifika saa 4, hiyo kitu alitoka. Alafu tukachukua tukaenda kutupa kwa choo. Alafu kifika asubuhi anaendelea na kazi yake kama kawaida.
Many others who go through this induced abortion from herbs and other sources haven't lived to tell their story. Now, that's the story of a mother from Rongo. And to help us just discuss what mothers, what girls, what young women go through in the country is a panel of eminent person, if I may say so. And to my far left is Bishop Godfrey Kimani, who is a local senior pastor at the Kikuyu Calvary Temple and a district overseer at Kiambu West. Next to him in the middle is Martin Onyango, who is a senior legal advisor for Africa at the Center for Reproductive Rights. And last but not least, next to me, to my left, immediate left, is Professor Joseph Karanja, who is a consultant obstetrician and gynecologist and a professor of obstetrics and gynecology at the University of Nairobi. Now, gentlemen, welcome to this discussion.
Thank you.
And it's interesting that we are having a discussion of abortion with a panel of gentlemen. Thank you very much for making your time this evening. So now we've had the story of the lady from Rongo whose daughter procured an abortion, and well, the daughter is alive and well, thank God. So, Professor, why do women go for induced abortions?
Women go for induced abortion because a woman who is pregnant when she has not planned for that pregnancy is in a very desperate situation. She knows either she will not be able to afford this to bring up this baby, or she is in school and now will have to stop going to school, and her future kind of ruined. Others may have conceived in some situations where, pregnancy is not wanted. Like unmarried women in many societies are not supposed to get pregnant. Schoolgirls are not supposed to get pregnant. Women whose husbands are away abroad are not supposed to be pregnant. So situations like this can lead women to seek abortion. Very often unsafe abortion, because safe abortion in this country, although allowed by the law, is very restricted and stigmatized.
Okay, yeah. We'll get to that discussion on actually the legal framework around abortions in the country.
Yes.
But I want to get to Martin Onyango from the Center of Reproductive Rights and the people you interact with and meet. What are the reasons that they give for seeking abortion services?
I think taking over from where Prof has left, those who seek abortion services are women and girls in need of these services. But the real challenge here is why would women and girls who need a health service like any other health service, for example, resort to unsafe abortions? From the clip we've seen, why would they opt to do it not to get the service from a public health institution, from a private health institution? What forces women to seek abortion services as a clandestine service, not a service, health service that is allowed by law? For me, that is really the real question that we need to address so that women can seek abortion services safely, openly within the law, like any other medical service any citizens can require.
Bishop Kimani, I would like your voice on this. The two gentlemen here talking about these services being restricted and clandestinely sought. I don't know, from a religious perspective.
Thank you, Mercy. I think I would, even before I go to the issue of seeking for abortion, I would want to maybe to ask myself and to ask all of us, in the first place, why would it come to that level? And I've come to realize, like when I look at many issues, teenage pregnancies and the likes of that, it is basically because of lack of proper information. Because if there was no unwanted pregnancy, because I want to think, as they have put it, that why we are looking for abortion services, it is because there is an unwanted pregnancy. And then I would want to address, and I would want us to address ourselves so much on the preventive rather than curative measure, much as they are important and good. We need to address the question of why in the first place is there that unwanted pregnancy. And according to my own observation, majorly it's because of lack of information. And maybe as to why, particularly I like so much majoring on the teenage pregnancy, particularly is lack of information being taken advantage of, basically because they are not properly empowered. Yeah.
Okay. Prof and Martin, Bishop has raised an important issue of teenage pregnancies, early motherhood. All of these are talking about unwanted pregnancies that women then seek a way out of that situation. Why is the law restricting women in accessing services? I know this is, especially like in America, it's a very major discussion on pro-life and pro-choice discussions of, you know, the woman's health and the woman's body. Are we at a position where we are now able to discuss that as a country, or are we still sticking to the law and restricting these services?
My take on this is that I think the law is now not very restrictive on access to abortion services in this country. One, the discussion on access to abortion within the law has been broadly discussed, was a key component of the constitution-making process. And as a country, we've constitutionalized one particular aspect of healthcare provision. That although we've generally formulated the right to health as a right to every citizen and a right to access reproductive health care services, we've particularly particularized in Article 26(4) access to abortion services within the framework of the Constitution, and allowed trained health professionals to give an opinion for the performance of termination of pregnancy in emergency situations when the health and the life of the mother is in danger, or if Parliament formulates a law that then gives other parameters. And by then, enactment of the Health Act and the hopefully formulation of regulations thereunder, access to abortion services should then be fairly accessible, and this is a service that then should be available including public health institutions. It is now a public health service that should be available. So the question of restriction, to me, is more of stigma, and how do we give life to the protection that is already guaranteed to women and girls in the Constitution. It is no longer about what you feel about that provision, but it is about enabling women and girls who require abortion services to access it safely and within the law.
Well, when you say within the law and safely, the caveat,
yes,
as enshrined in the Constitution, is that in case of an emergency, when the life of the mother is in danger, and I see Prof is nodding here, that is the caveat. What about these women, like we saw there, she's a teenager, she's in school, she's pregnant, and now she doesn't want to keep this baby. Where is the law for these women, Prof?
Thank you, Doctor. I think the law allows even such girls, because the interpretation of health is according to the World Health Organization definition, which says health is a state of complete well-being, physically, mentally, and socially, and not just the absence of disease or infirmity. So the situation in which this girl found herself is also covered by that broad definition of health. We tend to interpret health in a restrictive way, that you have to have TB, you have to have heart disease, you have to have kidney disease. You may not have those, and yet you still will not be healthy according to the WHO definition. So we as healthcare providers have to give that broad interpretation when faced with the problems of women and girls seeking abortion because they feel they are not healthy, or they are in a situation where this is covered by the law.
So the argument here is that their mental health is affected by this unwanted pregnancy at this point in time.
Yes.
I don't know, Bishop, what do you have to say about this? This broad definition of health, according to the WHO, which as Professor has rightly put it. Yeah. But when we look at it in a singular lens where we are looking at health as a physical well-being. I don't know, what do you have to say about this caveat in the law?
Well, I thank God that we have a health professional here, and I remember this was a very emotive issue, both in 2005 and also in 2010 Constitution, yes, where the church was really pushing that abortion is only permissible or should be only be allowed where in the knowledge of a trained health profession. Because I remember that it even went so deep to, to want to understand who is this trained health professional. Because according to the word of God, life is given by God, and only God should terminate life. However, there was this route that the church was looting, that in accordance as Prof is putting it, to his maybe judgment that maybe the health of the mother is in danger, maybe in such circumstances. That's the only circumstance that maybe we felt, because I was part of the group that felt that life maybe of an unborn child should be terminated. It is important at this point to mention that we so much talk about the medical consequences of or the mental consequences of carrying an unwanted pregnancy. But out of my own experience, because we find all these victims, the post-abortion victims, coming to seek our services for psychological counseling and the likes of that. And I've come to realize that this has not been, nobody is answering this. Because my own experience has taught me that the post-abortion trauma is even more harmful in the long term of the life of this woman, be it an old woman, be it a middle-aged woman, or even a teenage, more than maybe the way the trauma is bigger and more traumatizing, and it's a long-term thing. Now speaking from experience, part of the counseling, than just maybe allowing or civilly facilitating this pregnancy to be carried to term. And maybe we can be able to handle, it has proven it has been easier to deal with this maybe young or old or middle-aged woman looking at this child, though they never wanted them. And experience has shown that even in marriages, there are unwanted pregnancies, where women first of all reject that pregnancy. But after much counseling, right alone when they see this baby, you realize that they really regret that they were planning to abort this child. And I think I would like to look at it from that perspective. Yeah.
Okay. You've raised an important point about the consequences and the long-term consequences of abortions of an unwanted pregnancy. And I want to just hear from Prof about some of these consequences, especially of unsafe abortions, where we've had, or probably you've an experience or had to do correction on some of these procedures that people do in seeking unsafe abortions. What are some of these consequences that you've come across in your many years of practice?
Unsafe abortion can be very traumatizing. And the reasons are because of the complications, of the suffering that the woman or girl goes through. Some of them are perforations of the uterus, where the uterus might be removed because it becomes rotten. Others are injuries to the intestines, because people who performed the procedure don't know the basic anatomy. They pass instruments that go straight to the intestines and injure them. And those women will have their intestines resected, parts of them thrown away. Others will live with a colostomy. That is a bag where feces are draining for several months before they are taken back for a major procedure to connect the two sides of the intestines that survived. And obviously, you expect women who have undergone such experiences to report to the bishop later on with the post-traumatic syndrome after abortion. But this will be very rare in a woman who went through proper counseling, through a procedure that was easy because she went to the trained health professionals. But obviously, it will happen to the women who went to the quacks. Yeah. Thank you.
Dr. Mercy, maybe we are forgetting, for me, I think the gravest consequence of unsafe abortion is the many women and girls who die in the process. And the Ministry of Health itself in 2012 puts the number to about 17 daily. So we are talking about 17 women and girls who die daily from unsafe abortion, who never get a chance to then go through the treatment or to report to a religious institution for support afterwards. And then a critical look at who then forms this population of women and girls who die from unsafe abortion. Because the question of legality is settled in the Constitution. We cannot debate that. Why we cannot access safe and legal abortions in public health institutions, for me, becomes the real issue we need to discuss. That why do we still allow, even after passing the Constitution, after passing the Health Act, that then clearly incorporates the World Health Organization definition of health, we've made that part of our law. We are clear on what Kenyan women and girls are entitled to in the Constitution and in the law. But in 2012, we still say 17 die daily, and hundreds of thousands still get long-term life-threatening effects because of unsafe abortion. So for me, that is really where we need to drive this discussion. Why are we denying these women and girls access to safe and legal abortion within the law and without stigma, so that those in need can walk in and receive a safe service?
Yeah, and it's a critical question, which I hope by the end of this show we'll have addressed, whether we are opening up this discussion to make it known to the public that, you know, they can still access safe, legal abortion services, as you've put it. And before we get into that discussion, I want us to listen to one of the nurses that I interacted with, who has seen a number of women, especially young girls between the ages of 14 to 24, who come to her facility when they're in really critical conditions after accessing various other avenues of abortion, and some have actually lost their lives. So let's listen in to Nurse Marisa on her point of view and what her experience has been in abortion services. The profile of those who seek abortion in every community is the same. Everyone.
Most of them, they come to inquire about post-abortion care. They have attempted to do their abortion outside, and it has failed. Or some of them come when they have, it has already started, but it has stuck inside with so many complications.
That is the catch-call issue, as explained by Nurse Marisa. She says the question on abortion should be discussed in the open more often so that communities can understand the magnitude of the problem.
And somebody has come for that to procure that even safe or park. We must cancel and give her. We should not leave her, because she may go and do something very serious outside.
There are many women who are not so lucky to tell their tales after failed abortion procedures.
It was 2016. She had sepsis. It was bad. Yani pus was pouring, like water. Lakini we referred. She came when she was sick. She was admitted in the ward. After that is when we started to say, ulipata mtoto? Did you give birth? No. What happened at he na he na he? We want to refer to tobacco. Like she went and died.
And since the topic is by and large a taboo, many more fall every day due to quack services and lack of proper health management.
When they have found themselves in problem, it's now the others will tell her, drink homo. Just go and dilute homo, drink. Some will go to some doctors who are not trained. You know, there are some people are private, but they are not qualified people. So they don't know anything.
So that is the sad reality of what women have to go through out in society when they get an unwanted pregnancy, and some are seeking to abortion services to terminate that pregnancy from quacks, from some other, as Nurse Marisa said, they are diluting some detergents and taking it in a hope that they would terminate that abortion. We'll take a break from there, and we'd bid goodbye to Martin Onyango, who is a senior legal advisor for Africa at the Center for Reproductive Rights, and we'll be joined by Alan Maleche from Kelin just to continue with this discussion on abortion services, and we'll be addressing specific issues raised by Nurse Marisa during that clip that you saw shortly. So don't change that dial. Stay tuned with us.